back, friends. Well, if you haven't had either an MRI, or a CT scan, you've probably heard of them. So what's the difference about them and how are they similar? Dr. Underhill joins me now. Good friend of the show. Thank you for coming back.
My pleasure.
So these are two that, we hear interchange, probably a lot of differences about them. Interesting for the public to know. Let's start with MRIs. What is it and how is it used?
MRI, in a sense, is a large magnet. It uses different radio frequencies, creates a lot of noise, and creates different just pictures of the body based off the way it shifts hydrogen bonds within the body.
And why would someone need an MRI?
MRIs are really good for looking for certain parts of soft tissues, especially parts that we can keep still because the sequences take a little bit longer, so knees, joints, brain, things like that.
So this is the one that you go into the tube for, like we're seeing right now?
It's more of a tube. They're starting to make more open ones that are good, but they're still going to be the more enclosed of the two. Are they?
Okay. Any tips for people that are claustrophobic? I've had some people in my life with that.
Sure. Those headphones that they give you are great. One, it protects your ears. You can listen to music, and then the text can talk with you. Claustrophobia, too, we have some patients that talk to whoever their referring doctor was, and maybe they get a little Ativan or Valium beforehand. It's just a little something to take the edge off.
Something to calm you down a little bit. Okay. What about CT scans?
CT scans are X-rays. It's a tube. It's an X-ray, constant X-rays that spin around you and creates a three-dimensional picture for us. It does have radiation, not as much as people worry about it, but we don't want to have one every day.
Yeah.
They're going to be more of your, I hate to use the word screening, we do them for screenings, but it's going to be a more general exam. You can scan head to toe in under a minute.
Okay. And then tell me about the similarities. How are these two alike?
They're all part of the arsenal we need to keep ourselves healthy.
Yeah.
They are somewhat, a CT scan, you still have some claustrophobia.
Yeah.
It's more of a giant donut. So even though, that one's a little easier because as you go in, your feet are out in the open and all that stuff. But
okay, so no worries about people that are claustrophobic with that one.
Some people have a little bit, but it's much better.
Yeah.
And they're quicker scans too. Usually a CAT scan's or a CT scan is going to take you 1 or 2 minutes and you're done.
Okay.
MRs can go upwards of 40 minutes to an hour, depending on. Sometimes shorter.
Yeah, so any certain situations where we would request one or the other?
Really, your doctor's going to order something, and then the way we're moving with the American College of Radiology and Medicare, Medicaid, there's a kind of a guideline principle for using the best utilization. And then they're going to run most of the scans through a radiologist first, so they're going to protocol it saying, I think this will be a little bit better, maybe this one's going to be a little bit better.
Sure. Okay, any misconceptions about the two of these?
I think radiation, as far as CAT scans. Sometimes we worry about radiation. It is something to be very concerned about. Somebody doesn't want to get one of these every week.
Right. So radiation is something that can accumulate. Is that correct?
It does, and we try to keep track of that. We don't have something if you lived in Los Angeles and you lived in Boston, now you live in Indianapolis. It's hard to keep track of all of that dose. But we do try to keep track of who's had too much or how much.
Okay.
But they are life-saving. They were listed as one of the game-changing things in healthcare in the 20th century.
Really? Well, that's good to know, because as soon as you hear one of those two terms, we tend to worry or get nervous. Like, does this mean something bad? So is there anything that could calm us down about that?
I've had both.
They're life-saving. You've had both. Okay.
Yeah. I would let anybody in my family have either one. I think they're great if used appropriately, and we do screen for and make sure everything's as safe as possible. Yeah.
Okay. Where can we find more of you, Doctor?
Northwest Radiology. You can Google that for flat rate pricing if you want to know cost, because there is a cost between the two of them. Just Google Northwest Radiology and flat rate pricing, and that'll give you a list of our prices.
Okay. Don't be afraid of them. Take the guidance from your doctor, is what I hear. All right. Thank you so much. We appreciate your time and your insight. All of that education is great to know. Mike, I'm going to send it over to you.
All right, Nessa, thank you so much. It was interesting. I didn't know those the differences between those two. Now I know.